you. And I'll just say, thank you for joining us today. I think for all of us on this panel, it's just such a privilege to have these kind of programs to do with patients. And, we love taking care of myeloma patients, and we love reaching out, speaking to you, listening to your questions. So we'll talk a little bit more about how taking charge of myeloma, but thinking about from the team approach and also some dietary needs. If you go ahead to the next slide, please. So I like this picture, right? Because, we talked about this earlier, that while we're taking care of myeloma, we're taking care of the patient. And the patient's in the center. It's in the center of what we do. And how we choose to treat you, right? So your patients will come back from support group and say, hey, so-and-so's on this treatment. Why are they getting something different than what I'm doing? And that's because we tailor our treatment to you. The biology of your disease, the side effects that you've had, it's, your team really needs to get around you and do what's best and how it works for you. And so when I think of the team, right, we have our oncologist, and you may have your myeloma specialist, like the physicians who are here with us today, but you might still have that community oncologist that we collaborate with. You've got your nurse practitioners and physician assistants, your primary care. A lot of times you've come to us because your primary care is the one who actually noticed that you had this abnormality, worked up the myeloma, and then sent you our way. So, your caregiver, it's been a little more challenging this past 18 months because in your visits, we haven't always been able to have your caregiver present. Hopefully that's getting better in the center where you're treated. But we also have nutritionists, our clinical pharmacists, so this whole team, and that's the approach that you can see here with the IMF, but that's certainly the approach that we take at Emory, is that we have this team around you. And so what we want you to feel empowered to ask questions, to stop us when you don't know maybe something that we've said or don't understand it, or question us about something that we're suggesting that you do. I always recommend that patients bring questions with you. You wait a long time to see us. I'm like Dr. Joe. I don't like that computer in front of me. I'm not doing my notes while I'm seeing you. This is your time with us, right? And so bring those questions, have no, side effects and things. But ways to communicate with your whole team and understand that you have a whole team around you. You can go ahead to the next slide, please. So, we talk a lot about shared decision-making. I feel like, we've been doing this for some time, but we talk about it more because there are options. It's not all patients get treated the same. And so, while it, typically we see, in particular with an African-American diagnosed in your mid-60s, we see patients that are much younger. And this, right? You're working, you have other responsibilities, things to do. And so those treatments really, we have to make that decision together. Some of you see us in our clinics, but you actually go to a different infusion center. And so we really need to know, what are your goals? What are your preferences? Are there financial concerns? Are there things that we don't know? Are there things we forgot to ask sometimes? So, again, arriving at these treatment decisions together, and especially in the relapse setting, as we've talked about today, in that upfront setting, we risk stratify based on the biology of your disease. For us at Emory, we're talking about clinical trials from day one if there's a suitable clinical trial. But we do make these decisions together. Next slide, please. So how do you know what to ask at your appointment, and what you can expect? I find that our patients are very savvy. Patients not only want to know about the treatment they're on, they want to know about the next line of treatment. If this stops working, what are you thinking? Or maybe you're in that state where you're in that biochemical relapse. We're keeping you on your current therapy, but we're already thinking about what's that next line, or what's that clinical trial that might be appropriate for you. So it's good to have those open conversations so has there been a change in your life? Something that we need to know about. Is it challenging for you to get to us? So is it better for us to recommend something that you could be treated with closer to home, or something that's oral if it's suitable for your myeloma. And so you always want to bring these questions to us. The IMF also has tip sheets and questions that they as well can help direct you on what are the questions I should be asking you. I've had patients say that. Is there something I'm not asking you that I should? Oh, go ahead. I keep wanting to forward myself here. So what are those helpful strategies when we're thinking of prevention? How do we remain our healthiest as you're going through myeloma treatment, right? Stress is very challenging. It's on you. It's hard, keeps you from sleeping, can add to your fatigue. So what are those relaxation techniques? Have we referred you appropriately to somebody that might help you with that? What are those complementary things? At our cancer center, we're working right now on further building out our integrative oncology group, and that's looking at those complementary things. Acupuncture, we have a nutritionist, we have a rehab medicine physician who specializes in oncology patients. So all those things that can help. Maintaining your weight, having a healthy diet, and we're going to talk about that a little bit more. Exercise, right? I see you in clinic and I say, are you getting some exercise? And yeah, I'm walking. And I see the caregiver or your spouse over there going, no, and it can be challenging sometimes. Maybe you have pain issues, but the healthier you are, the better you're going to tolerate your treatment and the better you're going to feel, right? So what are those preventative things? In our circle of who's my team taking care of me, there's still that primary care provider. And a lot of times you spend so much time in your oncology office that you don't necessarily want to go back to your primary care, but you still want to have those normal health screenings, that routine health care, those things that we don't necessarily check, right? You still want to maintain your hypertension or your diabetes and remain the healthiest that you can be. If you're a smoker, we really want to stop smoking. That's going to be better for your overall health. Maintaining your dental care. A lot of times if we're putting you on a bone agent as well, we'll make sure that you've had that dental assessment prior to starting and throughout. Maintaining your kidney function. We were very careful about prescribing things for you or having you take things that might be more harmful to your kidneys, even if you have normal kidney function. So those things like ibuprofen, we tend to stay away from that. This is why we nag you about hydration. Everybody feels better when they're better hydrated. And then also protecting your bones. So calcium, vitamin D supplement. Are you walking? Are you getting some bone strengthening type of exercises? All really important to maintain throughout, because you'll tolerate your myeloma therapy better and feel better. Next slide, please. So how about diet and the immune system? Yeah, so we need food to give us energy. So you can think about it for like putting gas in your car. So if we're not eating the right things, we're not going to feel as well. So how do we get those nutrients to boost our immune system? We need this for energy. We need adequate protein intake. We talked about fluids, nutrients, right? We need a diverse amount of foods for our gut and to fuel us with energy. And we also want to minimize inflammation, feeding the gut microbiome. What does that mean? And somebody asked in the chat that I noticed, how do I get my normal gut microbiome back after transplant? And so what are those things? What does that mean? What is the gut microbiome? I think of it as this army, right? And we've got good bacteria in there to help break things down, to help us fight infection. And so after transplant, especially if you've had antibiotics with it, your gut just might not be working as well. So what are those foods that you can eat to help you with that? And those are things like legumes, beans, fruit. It's going to give you more fiber, and it's going to promote growth of healthy bacteria. You can go ahead to the next slide, please. So remember, you want this diversity in there. And it really takes about 3 to 12 months for your immune system to bounce back after a transplant. So what are those things that we should eat? We think of a Western diet, higher in sugar, higher in trans fats, higher in saturated fats, which really aren't good for us. And if they're high in those things, then they're low in those complex carbohydrates, fiber, micronutrients, those things that we really need to fuel us and to fuel that energy. And so if you think about this, if your diet only consists in these types of foods, it gives us what's called more of a metabolic induced inflammation. And inflammation, it means your gut's constantly chronically activated to try to counteract this. So especially with high intakes of saturated fats, you get this chronic activation of your innate immune system. And if you said, well, what is that? You know, if it's been a while since you've been in a science class, this is your barrier. This is your protection. And things that are part of your innate immune system are things like your skin, right? First defense against something penetrating, or bacteria. This is why we wash our hands. This is why mask wearing is effective, right? Because we all touch our face, and wearing a mask keeps our hands that might have bacteria out of your face. So, you know, boosting and protecting this system and eating more of an anti-inflammatory diet. So what does that mean? That's more of a plant-based diet. When you think of the Mediterranean diet, you think of plant-based, fish, healthy fruits, fats and oils. This also reduces your risk of heart disease, all things that we want to prevent as we treat you with your cancer. This is also a better diet to prevent certain types of cancer. So does it mean that you can never eat anything off of that? You know, we like to tell people to eat things in moderation. You don't want to diet high in sugar. You don't want to only eat what's typically that Western diet. But if you can really get more to that plant-based fish and things that are healthier, your gut's going to be much happier as well. If you can go next slide. So how about fatigue, anxiety, and depression? Yeah, fatigue is the most common reported symptom, and you look at that, 98.8%. Our rehab medicine physician that I mentioned lectured us the other day, the advanced practice providers, and fatigue is probably one of the biggest things that he sees in his practice and why we referred to him. But he mentioned a study that looked at oncologists when asked about what do you think the number one symptom or complaint for your patients is, and they said pain. And when they asked patients, they said fatigue. Now, it doesn't mean pain is not an issue, it is, but fatigue is huge. And why do you have such fatigue? It could be lack of exercise. It could be from your myeloma itself. How about the treatment we give you? Now, there's not a treatment out there that doesn't come with some level of fatigue. And it can also be what's called myelosuppressive, where we drop your counts a little bit. So that's one of the reasons where drugs like Revlimid and pomalidomide, you take it 3 weeks on, 1 week off, just to get that extra week for your counts to rebound from that. And so, you know, are we asking the right questions? We're good at taking your vital signs and asking you about your pain, but are we asking you the right questions about your fatigue and how much is it impairing your life and your activity? We also see anxiety, you can see in greater than 35% of patients, and depression nearly 25%. And I don't think any of us are surprised by that. But again, are we talking about these things in clinic? You know, there's other things that add stress to your life, those financial concerns. Nothing we do is inexpensive, and we do myeloma treatment, and we add, well, then you also need to be on this, this, and this, right? So for some patients, they have to decide, you know, which things do I fill? So we should know those things, and we should be cognizant of that when we're prescribing something for you as well. Other stressors, talking about change in social status, sexual function. We're not always good about asking you those questions about how do these drugs impact those normal aspects of your life. So these are the things that we should be talking about. We want you to bring these to us as well and make sure that we're controlling these to the best that you can be living at your full potential and where you want to be. And I'm going to bring exercise back into that, especially with fatigue. And are we bringing some kind of exercise or physical therapy in that can help you with that, even if you're having pain issues? Next slide, please. So what about those financial burdens that you have? There are resources out there. For us, we've got social workers in our clinic to help work you through that. But if we don't know, we don't always get you that help that you need. So medical costs, your premiums, co-payments, traveling to clinics sometimes can be an effort. In the Atlanta area, we get patients from all over. You might be coming several hours for your treatment. And here we are, right now, gas prices are rising. So you might have some challenges with those travel expenses. Medical supplies, getting what you need. As we talked about, the cost of your prescriptions. How about time away from work? We have multiple infusion centers. One of them's open on the weekends, so we can provide that to patients, if they're working during the week. But how about your caregiver as well? Them taking off the time. So all these things we can help you navigate. And the IMF also has guidance you can see there's an info line and also a phone number that you can call to also another way to look for what are those resources that are available to you. Next slide, please. So infection prevention and treatment. So we know that a lot of our treatments and post-transplant, certainly you can have a compromised immune function from this. So good personal hygiene, washing your hands. Can't talk enough about that, especially in the last year and a half. Wearing masks, washing hands, this has been part of our discussion and our conversation long before COVID came in, but it's certainly become more important. Avoiding people that are sick. We're getting a lot of questions. The holidays are coming up. People want to gather. We're having those conversations about, are people vaccinated? What kind of behavior? And in some cases, if you're not sure, right, we're still asking you to be very careful. We're asking you to get the COVID vaccine and the booster, still wearing your mask. We know that you may not, as a myeloma patient, get that same immunity from your vaccine that another patient would. So we're still asking you to be careful, keeping that distance. Immunizations, we tend not to give live vaccines to our patients. Post-transplant, it's going to vary a little bit, but the recommendation for an MMR is the only live vaccine. And typically that's about 2 years after transplant if you're not on steroids. And that's going to vary. And that's something to talk to your local team about. But the other thing, antibacterials, we tend to give you antivirals. So that's that acyclovir or Valtrex, because we see a lot of cases of shingles. Sometimes you might be on an antibacterial as well, just because your counts are dropping. So these are things that you want to let your team know about. If you're having symptoms of fever, 100.4, shaking, chills, even without a fever, just don't feel right, dizzy, low blood pressure, these are all things that can be very serious for you and that we would want to know about right away. Okay, next slide. These are resources that are available to you. If you haven't gone to the IMF's website, it's just, there's a plethora of information, right? On every treatment out there, as soon as it's approved, they have a pamphlet for it with side effects. Programs like this, we've had different types of programs. Stephanie Boyer, who's our nutritionist in our program, and I did one on nutrition in this past year and how it relates to myeloma patients and side effects from treatments. But somebody is always available to you at the IMF. But certainly talk to your team, talk to your local providers and practitioners, know who your team is. And hopefully, you've got that relationship that you see the joy that they have in practicing and taking care of you, and that they're really focused on you, the patient. I think that's it. I don't think I
Thank
have
you
any
so
other
much,
questions.
Charise. What a fantastic talk. I appreciate every time you present it, to look at the whole of the person and not just their plasma cells. Sometimes as doctors, we can get focused on the tiniest things. So thank you for that. And I know I see some other questions are coming in that we're going to have for you.